Hey guys, welcome to our channel once again, Medical Students Reacting to Medical Series. As you can see, today is just Richie and I'll be reacting to a new medical series. I hope most of you out there have seen it before. Monday Mornings, episode 1 of season 1. So let's start.
Why you call typhoid aneurysm, huh? Discriminate.
I'm sorry to hear that song, baby.
Guys, so in the medical field, as you are seeing now, when doctors gather like this, it's time for defense of cases. As a medical doctor, if you come across any patients or if you handled any patients throughout the week, there's a time where you have to defend if the patient died or the patient survived. So let's take a look at what will happen here.
Doctor, that first time you saw her, did you do a full physical examination? Did you order any x-rays? Blood work?
No, sir.
Did you do anything other than prescribe extra strength Tylenol?
In retrospect,
Alright guys, let's quickly talk about something here. Now there's an error the doctor made. As a medical officer, when you start practicing, you get to a level where you become so experienced and so you will tend to assume certain things based on your experience. The head of department asked the doctor who presented concerning some examinations he was supposed to have done before prescribing the drug. And so my advice for you out there is, no matter the level you get to, try as much as possible for every patient to order for any examination you can ever think of to be sure of your diagnosis before going ahead to prescribe a drug, and it will help you.
You were right. Mrs. Whitman had a pulmonary embolism. She's now on round-the-clock infusions of heparin. She's been throwing tiny emboli to her lungs. You have my gratitude.
Alright guys, quickly let's talk about pulmonary embolism. Pulmonary embolism is a term used when an emboli, singular embolus, get lodged in a vessel in the lungs. That is when you can see a patient has pulmonary embolism, and it can give signs like chest pain and then dyspnea. Okay, to break this down for those of us who are non-medical personnel as well as students, when we say an embolus simply means a substance that can travel through blood and then lodge in any blood vessel anywhere to stop the flow of blood, and the typical location normally is in the lungs. Okay, there are types of this embolus. There is fat embolus, which normally occurs in cases of bone fracture. There is air embolus, which normally occurs in case of injection, IV injections. There is amniotic fluid embolus in case of pregnancies. There is thromboembolus in case of blood clot formation in blood vessels. Now these substances, when they form or when they get into the blood vessel, they travel all the way through the blood, and then mostly the typical location for these substances is the lungs. That is where they get stuck in a blood vessel and then give these signs and symptoms of chest pain, dyspnea. There are other signs and symptoms that the patients can manifest. So that's simply about pulmonary embolism.
Dr. Wilson, you have in front of you a brief medical history of the boy's biological father. Could you please read out the highlighted portion?
Von Willebrand's disease.
Wow. Von Willebrand's disease. That's what the doctor missed. No wonder the head of department was asking a lot of questions. For the medical personnel, I believe most of us know what von Willebrand factor is. Now, to the layman, to those of us who don't know what it is, let me break it down for you. Von Willebrand factor is a factor that helps in blood clotting. When there's an injury to a blood vessel, this factor gets exposed and then it helps basically blood clotting. So when this factor is not present, in other words, when there's a deficiency genetically, it means it's a contraindication for operation because the patient will bleed and bleed till death. So that was what the doctor missed. That was what caused the boy's death. So he should have followed the protocol of taking into consideration the past medical history, the past family history, to get to know about the dad. And that was what the head of department was asking about. So the doctor missed that. If only he had known that the father had it, he wouldn't have operated on the guy. Alright guys, there you have it. Monday Morning Season 1 Episode 1. That is what I just reacted to, and honestly I enjoyed it. This was a good one. I'll give it an 8 over 10, which is good. So I'd like to say that what both doctors had in common was neglecting to follow all protocols, and the consequences they had was losing their patients. And you know, that's an advice I would like to give medical personnel out there, that try as much as possible to follow all protocols just to be on the safer side. So thank you very much for your time. Thanks for watching. Make sure you subscribe, make sure you share this one, make sure you like, and don't forget to drop your comments. We'll be expecting. Thank you.